My agency actually does not have a customer service program. Instead, what my agency does is we have a program for anyone over the age of 60 years old that may live alone or live with a husband or spouse that may have medical issues or may not be in very good health. And what we do with this program is we check in on those people once a week. They can sign themselves up for the program, or someone can sign them up for the program, either one. And what happens is we will call them once a week. We'll check on them, ask if they need any groceries, ask if there's anything that we can do for them, just so they know that we're there for them. It also really helps with public relations, as well as it has really cut down on our frequent flyers. EMS does this program along with law enforcement and the fire department. We each break up into different groups, and we have a different section of the community that we focus on. And so what we do is we'll call them once a week. If they don't answer the first time, they could be busy, we'll try again in a little bit. Usually about every 30 minutes. After the third time, we actually have a key to their house. What we'll do is we'll then go inside. If we can't get a hold of them, maybe see if they're falling, maybe see if someone's hurt, or that good stuff. We check to make sure they're not home first before we do that. But a good experience I've had with this is there's an elderly lady that lived across the street from me, actually. That was in our program in my district. We called her, checked on her, couldn't get a hold of her. Tried 2 more times, still couldn't get a hold of her. We went to her house, keyed into her house to find that she had fallen and wasn't able to get up. So we were able to assist her up, check her out, evaluate her, determine she didn't have any injuries and she was okay. And she was very thankful for us. Her family showed up short time after. They were very thankful for us as well. And we continue to do this. It promotes positivity within our community as well as our agency. This actually does help a lot. A lot of our people in our community are very thankful that we are able to do this and that we are willing to. A poor example I've had was with this same program. There was an elderly gentleman who we could not get a hold of. We kept calling. So we showed up to his house. When we did, we keyed inside, walked in to find his grandson, who we didn't know at the time was his grandson, who met us at gunpoint because he thought someone had broken into the house. And turns out the older gentleman had gone to the hospital, transported by EMS. It's actually a 911 call. We get all of our information from 911. That's who runs the program. So what we could do to fix that would be, if 911 does receive a call for EMS, obviously it's logged somewhere. So I think that it should be logged in the 911 system in that program that they are not home. So we should not try to contact them. We should not try to go to their house unless they request us to check on their house, because we have done that before. And so the biggest thing I think that could be done differently is dispatch, logging that in the system for us or law enforcement or fire, whoever it could be, so that we are not put in that potential situation again. This program works very well within our community, really supports just that customer service, very community-based EMS. Everyone really looks up to us here in our community for what we do, as well as law enforcement and fire department. It's a community effort just to check on those in need, and it's really helped during this time of the coronavirus. We were able to do a lot, get groceries for people or any needs that they may need. It's been very beneficial. So that's our program, and that's what we could do differently, and that's what we're doing great.